Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Individuals with inflammatory bowel disease are at increased risk of developing blood clots after surgery. Such clots can lodge in the lungs, creating a life-threatening condition known as pulmonary embolism, or PE. These are the main findings of research published online ahead of print in the Archives of Surgery. Ways of preventing the formation of blood clots, or PE, following surgery include taking blood-thinning drugs, wearing compression stockings that prevent blood from pooling in the legs, and moving around as soon as possible after surgery. Researchers from Massachusetts General Hospital analyzed data on nearly 2,500 patients with IBD and more than 250,000 patients without IBD who underwent surgery in the U.S. in 2008. Among these two groups, the investigators compared rates of blood clots developing in the deep veins, PE, heart attack, and stroke during the month following the patient's surgery. Among all the patients, the rate of blood clot, or PE, was 1%, but it was as high as 2.5% among those with IBD. The risk was twice as high for IBD patients who underwent surgery at a site outside of their intestines. After taking into account other factors that can affect the risk of developing a blood clot, those with IBD were found to have double the risk of those without IBD. When the surgery occurred outside the intestines, IBD patients had more than 4 times the risk of blood clots, or PE, than those without IBD. Rates of heart attack and stroke were not affected by the presence of IBD. We had a chance to speak with Dr. Frederick Millam, one of the investigators of the study, who offered some further insight.
Risk of DVT or PE was approximately 2.5% in patients who had inflammatory bowel disease, either ulcerative colitis or Crohn's disease, and as compared to 1% for all the patients who didn't have either it didn't have one of the forms of inflammatory bowel disease. So that, I mean, if you have inflammatory bowel disease and you're facing surgery, I think a reasonable discussion to have with your surgeon would be, what are his or her plans for DVT prophylaxis, which usually involves giving patients an anticoagulant. What are his or her plans for anticoagulation, understanding that the patients with inflammatory bowel disease have about a twofold increased risk of having a DVT or PE in the perioperative period.
Today's research suggests that special care should be considered for the prevention of blood clots following surgery among those with IBD. For Insider Medicine in Depth, I'm Dr. Susan Sharma.